Outer thigh pain driving you nuts? Whether it's burning, aching, or it just won't go away, don't reach for injections just yet. I'm going to show you the 3 most common causes of lateral thigh pain and what you can do about them today. We've gotten so many comments on our sciatica videos where people are saying that they have pain on the lateral thigh or the outside of their leg, which is not where the sciatic nerve actually runs. However, there are other nerves that run down there. So you may think that what you're suffering from is sciatica, but you have pain on the outside of your thigh, and that's what brought you to this video today. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I hold a PhD in Orthopedic Manual Physical Therapy, which means I spent 6 years after PT school studying the human body. And I am here on YouTube to combat common misconceptions that are keeping people in pain. And today our focus is on pain on the outside of your thigh. We are going to discuss the 3 most common causes, and by the end you'll be able to not only diagnose yourself, but know what it is that you should be doing to help calm down your pain. The first cause we're going to discuss today has a very fancy name. It's called meralgia paraesthetica. And what it is entrapment of the lateral femoral cutaneous nerve. So this one definitely has nerve type symptoms that go down the outside of the leg because that's where the nerve runs. So if you are like, I am convinced I have sciatica, however, it's down the outside of my leg and not the back. The back would be the sciatic nerve, that is where it runs, but it's down the outside of the leg, then chances are good that this is what you're suffering with. The symptoms of meralgia paraesthetica are burning, tingling, and numbness in the outside of the thigh. However, it's not muscle related. For most people, meralgia paraesthetica can be caused by a really tight waistband, recent weight gain, putting increased weight through the abdominal cavity, or prolonged standing or walking. Now, I don't know if you remember, but back in the 90s, we had these really low cut jeans that everybody would wear, and they'd wear them really, really tight. And we had so many cases of meralgia paraesthetica in the clinic at that time. I do admit that I see it less in the clinic now because waistbands have gotten higher, and so it's not putting pressure directly over that nerve. So what is the treatment for meralgia paraesthetica? Well, you want to avoid aggravating that nerve. So you need to avoid tight clothing, especially that hits right at the waistband. You want to keep your waistbands up above your hip bones. If you have recently gained weight and you believe that that's the cause for your meralgia paraesthetica, then managing your weight will help to decrease the tension on that nerve. If it's standing or walking that is increasing your symptoms, then you definitely want to modify your activities and figure out why it is that those activities are causing these symptoms to happen. Which leads to when should you see a PT for this? If you have already tried at-home techniques and you are not noticing a difference in your symptoms, then I would recommend you seek out a manual physical therapist. This person is going to be able to help figure out what it is that's causing your meralgia paraesthetica. Because you see, there could be some other things that are going on. You could have a pelvic malalignment issue. You could have some muscle imbalance that's causing some increased stress on this nerve. And these things you're going to need help dealing with to get your pelvis back in alignment, figure out your strength, all the things we need to do to keep our body in balance. The next cause of lateral thigh pain is trochanteric bursitis. We have these bursas or fluid-filled sacs all over our body, but particularly in places where a bony prominence, like this one that's sticking out right here, is going to have to contact a ligament, tendon, or bone. So our body lays down these bursas or fluid-filled sacs to decrease the friction over these joints and bony prominences. So we have a big one right here. This is our femur bone, so our thigh bone, and this one right here is called the greater trochanter. So it's a big bony prominence, and it's also going to have a big fluid-filled sac that's over it. You can Put your hands on your hips and feel all those muscles that are going right there. So it's a pretty big bursa. And when it gets inflamed, what happens is just like a water balloon expands when you add more water. When the bursa gets inflamed, it expands. So now it's putting stress on the muscles and ligaments and tendons that are going over it. Now, people who are suffering with trochanteric bursitis may indeed have pain all the way down their leg, but they are the ones who can put their finger right here and say, ow, that's where it all starts from. It may radiate to other areas, but if you can put your hand over that bony prominence, actually a finger, just point a finger at it, and you're like, ow, that is my pain, then you are suffering from trochanteric bursitis. Also, people who are suffering with trochanteric bursitis often cannot lay on that side because it will cause a reproduction of their symptoms. Now, the most common mistake I see with trochanteric bursitis is that they will treat the inflammation, which is great, but they won't treat what caused it in the first place. So they'll do something like get a cortisone injection or, take corticosteroids or even deal with the inflammation naturally, but if you don't deal with what caused the inflammation, the tight muscles, ligaments, tendons, muscle imbalance, pelvic alignment, whatever started this problem in the first place, then it's going to continue to come back over time. So what do we do with that from a manual therapy point of view? Well, we want to decrease the tension surrounding that bursa. So all the muscles, again, the ligaments, the tendons that are surrounding that area, we want to decrease the tension so they're not constantly compressing on that bursa. We want to correct the walking or running or whatever your activity is form that may have put increased stress over that bursa in the first place. And it's really important to strengthen the muscles that are on the outside of the hip. You see, these muscles here, they're called the abductors, abductors. What they do is they bring that leg out to the side. Now you may say, well, I don't do that regularly. And you're probably right, most people don't. However, when you're walking, these muscles become very important to keep your hips level. So that old-fashioned runway model walk where you're like dropping your hips from side to side, yeah, that's not actually how you should be walking. We actually want to keep those hips steady and just moving forward. So we want to make sure that the outside of our hips are nice and strong so that we're able to do that. So when should you see a PT? If you feel like you have tried all of those techniques and you're just not getting where you need to be, you probably need some help because there is probably a deeper issue such as a pelvic malalignment issue. Maybe it's a postural issue. Honestly, it could even be a pelvic floor issue that is driving this trochanteric bursitis. All right, and the last cause of lateral thigh pain is IT band syndrome. So the IT band is your iliotibial band, and it originates from the muscles that come on the outside of the hip. Then it travels down the outside of the leg and attaches onto the tibia and the fibular head right here. Now, there's some controversy that it actually extends into the calf, and if you suffered with IT band syndrome, you indeed may have had symptoms all the way into your calf. Anatomically, we don't agree that it actually goes down in the calf, but secretly, I think it does. So iliotibial band syndrome is actually a friction that happens, particularly aggravating the greater trochanter. And a lot of people feel like there's like this tightness. There may be an aching pain. It may feel kind of deep. Sometimes it's a burning, but it's not a burning like a nerve pain because it's not that sharp shooting burning. It's more like a smoldering type of burning that happens. Now, the strange thing is that for some people, doing activities such as running or cycling actually helps decrease these symptoms while they're doing them, while other people actually have increased symptoms while they're doing the running or the cycling. How can this be? Well, what happens is as you're doing activity, you're getting the muscles to work. So the hamstrings on the back, the quadriceps on the front, which brings blood flow to those muscles. Now, both of those muscles do have some connection to the IT band. So it could be that increased blood flow helps to decrease your symptoms because you're actually getting some of that inflammation flushed out. While for other people, it may be that inflammation is actually being increased because you have increased blood flow. The truth of the matter is what causes IT band syndrome, which many people feel like is a tightness and they just need to stretch it. I need you to hear this. What causes IT band syndrome is weakness in the hip muscles, particularly the gluteus medius, which is that muscle that brings the leg out to the side, and rectus femoris, which is one of the hip flexors of the muscles, or bending the knee to the chest. When these muscles are weak, it causes increased tension in the IT band as the IT band tries to compensate. I understand that it's a poor compensation, having the IT band compensate for gluteus medius and rectus femoris. However, that's what our body does. It could also be due to poor pelvic control. So I see a lot of this after women have had babies, because initially when you have the baby in your belly, you have a lot of force coming through here, and it kind of actually helps to stabilize some women having that much weight on the front. But then you have the baby and that decreases the weight on the front. You still have that relaxing going all the way through your body, and everything's just kind of freaking out. The joints don't know how to move correctly. They may be moving too much, which the muscles then try to compensate. They end up tapping out, and it causes this IT band syndrome. What you need to do at home is doing some self-massage to the outside of the hip, as well as the very, very front of the hip, that rectus femoris, to make sure that these muscles are actually able to contract and relax correctly. Because the next step is going to be to strengthen these muscles, which is great if they can contract, slide together, and relax, slide apart. What I often see is that people go, oh, okay, I have IT band tightness. I need to strengthen this muscle up in here. I'll go do all these hip exercises, but the muscles are so tight that they're not actually relaxing. So they're just getting tighter and tighter and tighter. And they don't understand why they're doing these exercises, and it's actually making their symptoms worse. The other thing you want to do is make sure that your walking, running, or activity pattern is correct, so that you're not constantly causing increased trauma to this area and increased tension to the IT band. Okay, so we talked about it along the way. However, to make sure that we review, if you have meralgia paraesthetica, you will have nerve pain that goes down the side of the leg and often will be sharp and shooting type of pain. If you have trochanteric bursitis, it'll often be a slow, achy, kind of smoldering type of pain, maybe down the lateral thigh, but it will be point tender right there over that bone. And if you have IT band syndrome, it could be a feeling of tension or an aching that's going down the outside of the leg. Make sure that whatever you have, you're not just treating the pain, but what caused it in the first place. And if you feel like you've treated the root cause, but you're still not getting the relief you need, find a good manual physical therapist who will be able to figure out why this problem is still bothering you. It may be correcting your pelvic alignment, your gait pattern, your posture, your strength. There's so many things that could be going on. So you want to make sure to get a good, thorough evaluation to understand what started this problem in the first place and why it's not going away. And please remember, it is important to listen to your body. Pain is a messenger, not a mystery. If you like this video, give it a thumbs up. Please subscribe for more of our content. We put out videos 2 to 3 times a week. And if you're looking for some hip stretches and strengthening exercises that you can do to deal with your lateral thigh pain, I'm going to have you check out this video over here.